Fat transfers have gaining popularity over the last several years. We've been doing it for years as plastic surgeons, but with social media and the internet, it's been taking off. I think, though, the problem is that there's a lot of things about fat transfers that are not being clear or told to patients. So the patients come in with this preconceived idea that we're able just to take fat from one area, put it into another area like an implant, and you have an instant success. Fat transfers are very tricky. They're fragile. You're taking tissue from one area that has a blood supply, and you have to put it in certain ways that it can reestablish a blood supply in the recipient site. So there is a limit to how much fat you can put in at any one time. The other thing that women need to know is that you can't exercise. If you put fat in the breast, you have to be very careful with the bras that you wear. You can't lay on it, so you can't lay on your belly for about 6 weeks. You also have to have the donor site available. And many women that come to me that sort of want to try to avoid an implant, then they don't have the amount of fat that you'll need to actually do a fat transfer. The ones that I've done have done well, but you also have a risk of some asymmetry. And these are questions that you want to talk over with the surgeon, because it's a hard topic to just do in a very short period of time, because this is a discussion you need to know. But what you need to know when you see a plastic surgeon about a fat transfer, especially to the breast, how is it done? What are the chances of it not taking well? The studies show that we get about 70% of what we put in actually takes and actively lives after surgery, but it could be 70% on one side, 50% on another, so you have this asymmetry. The other thing that you need to know and find out about with the surgeon, it usually takes at least 2 surgeries and sometimes 3 of fat grafting to get the results you want. So that's the truth about it. It's still a good surgery, but it's not a one fell swoop. It's not one and done. You're back to the gym and you're avoiding an implant. For many people, implants are still the #1 way